we're seated in East Tennessee corporately, although we're spread out across the country. And so we do see the impacts of rural health and the limitations and some of the disparities that happen between which we experience in rural health versus an urban or metropolitan area.
You're listening to Further Together, the ORAU podcast. Join Michael Holtz and his guests for conversations about all things ORAU. They'll talk about ORAU's storied history, our impact on an ever-changing world, our innovative scientific and technical solutions for our customers, and our commitment to the communities where we do business. Welcome to Further Together, the ORAU podcast.
Welcome to Further Together, the ORAU podcast. As ever, it is me, your host, Michael Holtz, in the Communications and Marketing Department at ORAU. And y'all know I get excited about everything we do here at ORAU, but I'm really excited today to be talking about a new initiative that we are launching in our Research and University Partnerships Office. We're launching a couple of what we're calling research innovation clusters. And kind of the first thing we're doing around this particular research innovation cluster is a workshop focused on rural health issues, where we're inviting members of our university consortium to come together and look at some priority areas. And to help me talk about the RIC and the workshop and those priority areas are two of my favorite returning guests, because they've both been here before. First, I have Brenda Blunt, who is Senior Director of Health and Resiliency Strategy for ORAU, and Casey Thomas, who is Strategic Partnerships and Engagement Manager in the Research and University Partnerships Office. Brenda and Casey, welcome back to Further Together. I'm so glad to have you.
Thank you for having us, Michael.
Yeah, it's exciting.
And I'm so excited to be talking about the Rural Health Research Innovation Cluster and the workshop that we're doing in August. Casey, I want to start with you. How did this come about? And talk about what a research innovation cluster is, kind of from a high-level perspective.
Yeah, so a great question. And we call it the RIC, so sometimes that's a little bit easier to say than Research Innovation Cluster. This is an idea we've been kicking around for a few years, and we noticed within our consortium that we had sort of these little pockets of expertise, and they were clustered around all sorts of topics. You know, we would identify them everything from AI to space manufacturing to emergency preparedness, and really just in a more of an ad hoc manner. So we knew we wanted to do something a little more concrete and a little more coordinated. And so that's where about a year ago, this idea of the RICs really took shape, is how could we bring together our university partners with our ORAU experts, our industry partners, and really just coalesce around the idea of innovative research and translating research into practical application around these emerging issues that are of importance to ORAU, also to our universities and to our partners. And so this idea over the last year has really just taken shape, and there were a lot of discussions internally about where did we want to start. And we identified two priority focus areas, the first being emerging exposure science, and then the second one, rural health, which we're talking about today. And that was done in conjunction with Brenda and her leadership team and some other folks at ORAU as well.
Awesome. And Brenda, given where we're seated in East Tennessee, rural health is really important. Right? I mean, it's something we see, some of us up close and personal on, a daily basis. Talk about, one, why rural health is important to focus on. And then there are 4 priority areas. Talk about what those priority areas are, if you will.
Absolutely. So, as you said, we're seated in East Tennessee corporately, although we're spread out across the country. And so we do see the impacts of rural health and the limitations and some of the disparities that happen between which we experience in rural health versus an urban or metropolitan area. And so it's important for us from our community standpoint, but also as we look across all of our staff. And we have staff across the country. We have staff that are seated in other rural areas. And we know from a national priority ending chronic disease is really important. Well, rural communities experience chronic disease sometimes at much higher levels with higher mortality rates than our urban and metropolitan counterparts. And there's numerous factors that play into that. And depending on the area of the country that you're in, the factors may vary based on your particular rural community, but there are certain themes that are the same. So as we looked at what's of most importance, where do our consortium members kind of work and what spaces are they in and what are their priority areas that their research is looking at? We focused on a few things. So one, we know that access is a problem across rural health communities in various ways, but the workforce is a key driver of that. So our first priority area is really workforce development and retention. We know that the rural community workforces tend to make less than they could make if they went to an urban area. If they get their education in an urban area or metropolitan area, they may stay there rather than returning to their rural community. So really looking at how can we incentivize, how can we build up the workforce in the rural communities? And it's not just about physicians, because the other thing that rural communities do well, although we still lack an adequate workforce in that, is looking at other provider types. So community health workers, looking at doulas, looking at those various healthcare provider types that can help fill in some of those gaps. And then how do we leverage those types to fill in those gaps? How do we expand training and access to whatever, whether it's a certification, a licensure, what does it need? And then what does it mean to maintain and retain the workforce in a rural community so that they're not fleeing and going to other areas? So then that taps in, as I said, access to care is one of them. So that kind of was our second bucket, because in addition to building up the workforce, we look at access and how can technology help us with access to care. In rural communities, that can be slightly more challenging because of broadband issues, internet stability. There may be some lack of trust in using technology. You tend to have more independent providers, so they don't have access to the large technology platforms necessarily that a different academic provider may have. So looking at how can we leverage technology to also fill in some of those gaps and connect people to care. And then really breaking that down further, we know some of the key areas that are critical in rural communities are mental health and access to substance use disorder treatment. And both of those take a significant toll on rural communities. So how can we improve access to care specifically to treat mental health issues and substance use disorders? From there, when we talk about access, also looking at women's health. So in women's health, you think about prenatal care is kind of, everybody kind of goes to the obstetrics, but there's the gynecological, there's breast cancer. We know there's a lot of talk now about menopause and perimenopause and what does that mean for women. But having access to providers who understand those and also understand the cultural needs of rural communities, because we have different beliefs about some healthcare issues and there's different education levels available. So really being able to tap into providers that can speak specifically to women's health issues and help us address some of the mortality and morbidity rates that we see in women in rural communities. And then the last kind of big sub area is around preparedness. So we know that in rural communities, food security can be a challenge, which impacts people being able to prepare and be prepared and resilient. It impacts their health outcomes. We also know that natural disasters and occurrences impact rural communities in different ways. So while you may not have the volume of people impacted as you would in an urban area, sometimes getting the support to rebuild following or being able to even treat in the moment in the crisis is difficult in rural communities because we don't have as much access. Again, there's that term to services as an urban or metropolitan area has. We also, our agricultural areas are in rural areas. That resiliency directly impacts our nation's food supply it impacts the small family farmer being able to continue farming or selling out their property. And then we lose a key aspect of our food supply. And for those rural communities, sometimes those farmers are the freshest food that you can get. And they have access to them because it's their neighbor or it's their farm right down the street that they can go to if they need help. So how do we help those small farms and those farms in those rural areas be resilient and be able to come back from natural disasters? This year in Tennessee, we've had a drought. And there were a lot of farmers for several months that were worried about their hay because they hadn't been able to put up as much hay at that point in time as they normally would have. Well, that impacts them all year. So if you fall behind in hay early in the season, it impacts your entire farming season. And how do you maintain your same livestock levels if you can't feed them through the winter? So any type of natural occurrence, disaster that happens that impacts our farms in the rural areas impacts the broader community as well on an economic level, on a food level, and all of that then impacts our national security. So we felt that that was another key topic area that we needed to look at, and how do we strengthen that?
And we have truly expertise, right? We have subject matter experts on literally every one of the topic areas that you have touched on within our organization, and then certainly within the university consortium, which is really why this workshop is taking place, is to bring our subject matter expertise together with university consortium members who are interested in solving these rural health issues. Casey, talk about where we are with planning for the workshop and kind of what folks can expect if they choose to come.
Yeah, we're really excited about this. We wanted to bring people together to really sit down in the room and talk about some of these issues and get everyone on the same page with the priorities. We know we have a pretty wide variety geographically, and so we wanted to bring everyone together to talk about what's happening in your area. What are your research priorities? What are you seeing in terms of trends and needs, and where does the research go? Where are we looking to go together? And so that's why we open it up to the entire consortium versus just focusing on East Tennessee, for instance, which would have been very easy to do. But we're bringing in folks here in Knoxville. And so we have, I think, about 3 weeks or maybe a month left before the workshop. And really what we're planning to do is get everyone together in that room and talk through, like I said, those priorities, those needs, coming out with some actionable items at the end of it. How can we move forward in each of these focus areas? What are the things that we can accomplish in a 1 to 3 year time span collectively to really move the needle on some of these issues? So we fully expect that we're going to start really broad with a lot of ideas, a lot of passion, and we are going to have far more than we can reasonably accomplish. And that's fantastic. I think that's what we're all excited about. But eventually getting down to the boots on the ground, brass tacks of what we can move forward on.
And I think you told me before we started, we've got 28 universities already registered, but it's important for anyone listening to know, if you are interested, the workshop is not the be-all, end-all of participation in the RIC. Like, if you are interested in being part of this particular RIC, you can still participate even if you can't be in Oak Ridge for this event.
Absolutely. And we set the in-person workshop just as sort of a launch kickoff, again, because we knew this was such a big topic that trying to come to all of these ideas virtually was a little bit challenging. So the August 6th workshop is really just a way to start the conversation. We fully expect to follow up with multiple virtual engagements. So if folks can't be involved here in person, that absolutely does not mean that we're not able to accommodate you. We want the entire consortium to participate if they're interested.
Awesome. And Brenda, I have so many questions because just around mental health and substance use disorder, you have stigma issues that have to be overcome in communities, and again, trusting government, and when you're dealing with recovery or preparedness and response, and access to care, and again, trust with healthcare, and just there's so much to focus on. do you have an idea of where you think or hope things will sort of start, or are you just sort of, let's see where the group wants to go when everyone gets together?
So I'm like you. There are so many areas to go, and I very much, and any of our listeners that have listened to my other podcasts with you know that I look at kind of how we tackle healthcare. It's a big system, and when you pull one lever, you're going to move something else, and not always unintended consequences, sometimes positive and sometimes not. So, but I want to make sure that what we're doing resonates with our consortium members, because I think together with our consortium members and really teaming up with the consortium members on a particular topic and refining that topic, where we will get to a 1 + 2 = 5, not 3. Because we are better all together, and we are better when we put multiple minds together. So while I have numerous ideas of where I would love to see it go and research that I would love to see happen and kind of that practical application, I want to make sure that what we settle on resonates with our consortium members so that we're all active partners in achieving whatever it is we set forth to do.
Awesome. Casey, just to kind of wrap things up, talk again about when is the workshop? How can people get information? Also, I'll put the registration link in the show notes so that our university partner members who are interested, can register there as well. But when and where and all the things.
Yeah, when and where. It's going to be August the 6th. That's a Thursday at the Hilton Knoxville Airport. It's just the hotel right next to the airport in Knoxville. We are running from 10 to 3. So it is going to be a most of the day session. If folks are interested in coming to Knoxville for the August 6th workshop, or just being involved at a later date, they can email Brenda and I. That's probably the easiest way, and we'll bring you into the fold. We'll get you the registration link and all that good stuff. But like I said, this is August 6th is just the kickoff. We are bringing in partners, in perpetuity kind of thing. So bringing folks in as long as they want to play.
Awesome. Brenda, closing thoughts before we wrap things up? Anything?
I'm really excited about this. I'm excited about the approach that we are taking to bring in the universities to look at how can we apply what different consortium members already know based on their research. How can we apply it in rural communities? How can we learn from one another so that even if we're in different geography, but still rural, we can learn from each other and take those lessons to apply them to different communities and kind of scale what each of our members has learned. And I'm just excited about being able to tackle chronic disease in a way that will be meaningful and drive generational impacts.
Absolutely. Casey, closing thoughts for you?
No, I'll echo what Brenda said. Really excited to bring together our university partners to join in on this. There's a lot of excitement around the company, around this initiative, and it's exciting to watch.
So, well, I'm excited. I can't wait. I will be there helping tell the story of the day and what happens with the RIC, and look forward to reporting out what we learn and kind of where we decide we're going next. So, Brenda and Casey, thank you so much for your time this morning. I know we crammed this conversation into in between some other meetings that we had, so I'm really glad we were able to do this. So thank you both very much.
Thank you, Michael.
Thank you for listening to Further Together, the ORAU podcast. To learn more about any of the topics discussed by our experts, visit www.orau.org. You can also find us on Facebook, Twitter, and LinkedIn at ORAU, and on Instagram at ORAU Together. If you like Further Together, the ORAU podcast, we would appreciate you giving us a review on your favorite podcast platform. Your reviews will help more people find the podcast.